And good morning. I hope everyone's doing well out there today. It's morning here where I am at now. It may not be morning by the time you watch this, but I first of all thank you for watching this. I think that this is going to be a really quick, short video, but I think it's going to be very helpful in helping some of you understand how thyroids and migraines kind of work together. And one of the top hormone imbalances that I work with that can cause a host of unwanted symptoms or thyroid disorders. Thyroid disorders, you're probably wondering why is a chiropractor talking about thyroid disorders? Well, thyroid disorders can it controls a lot of things. Now, what the thyroid is a little gland in your neck, and it's kind of shaped like a butterfly. But this little gland is responsible for so many different things, including the metabolic processes. It controls temperature. It controls digestion. Here's where it applies to chiropractic. It is responsible for bone maintenance, and it's it helps with body composition. Okay, so it may help with the weight, muscle versus fat. It's even related into heart health, which and so all of this is influenced by the thyroid. So this thyroid hormone, the thyroid creates thyroid hormone, and the thyroid hormone goes throughout the body, is found in the blood, and it can influence a whole lot of health problems. It can really influence how we feel, and it can cause joint pain. Okay, that's why it's important for chiropractors to understand the thyroid. It can cause joint pain. It can cause muscle pain. Also, a lot of chiropractors deal with muscle problems. It can cause to with nerve. It can cause nerve pain. Again, this is right in the chiropractic realm, and it can cause headaches, which again, a lot of people who have headaches seek chiropractors for help with this. And so it's really important that we kind of understand the thyroid when it comes to some of these musculoskeletal disorders, because it's a possible cause of these conditions. And so when there are some studies that actually show this. In fact, there's one study that shows that 26% of participants with headaches disorders had increased risk of developing hypothyroidism as well. Okay, there's another study that links the Hashimoto's thyroiditis, which is an autoimmune disease, to the thyroid antibodies and pain. Okay, so these thyroid imbalances can cause pain, and a lot of people come to the chiropractor's office because they're having pain. Most of the time, it's in their joints or their nerves or their headaches or their muscles. But if we overlook the thyroid as a potential cause for this, then we may be missing something that I feel is very, very important. So there's also a clinical correlation between headaches and thyroid hormone, especially when these headaches are the migraine types of headaches. And so if you're suffering from migraines, you might want to check out the thyroid hormone, because that is very much associated. So I hope that this has been helpful. I know this was a really short video, but if you have any of these problems like muscle pain, joint pain, um, headaches, and nerve pain, if you haven't looked at the thyroid, please do. There's a really, really easy way to do that. In fact, I'm going to be putting up a little short little lab test that you can actually purchase on my website that explores this. And then we can certainly go over the results of that. So please give us a call, check out the website, and find out for yourself if your thyroid imbalances might be causing some of your joint pain, muscle pain, headaches, and that sort of thing. One other note, and this is a kind of a frustrating story. I have a patient that came in with her blood work, and she said her doctor said that her thyroid was absolutely fine. And I was looking at the blood work, and I don't know how the doctor could make that, because there was not a single thyroid test on that blood lab. And so I encouraged her to see if there's any other lab results that the doctor might have that do indicate something about the thyroid. But a lot of times our doctors, unfortunately, kind of look over this, or they only look at one thyroid marker and they miss all of the rest. And I've seen it in my practice. It's been missed. And so please make sure that if you are getting a thyroid check by your doctors, that they're going to check all of the thyroid markers, okay, not just one. And if your doctor will not do that, because a lot of times they won't do that because it's not covered by insurance, but I can get you a complete thyroid panel for under $100. So please, if you think that you might have a thyroid problem and your doctor won't check it, give us a call. We'll check it for you, and we'll get you straightened out and we'll also make recommendations that will help the thyroid. So again, thank you so much for watching. I hope this has been helpful. I hope it kind of started your wheels turning. And if you need help, please give us a call. We're more than happy to work with you and get to the underlying cause of your health problems. Have a great day. Bye bye.